The high-consist trial was a randomized trial assessing the role of cediranib as maintenance treatment in platinum-sensitive patients after chemotherapy. The trial reported a significant increase in PFS, but yesterday data of overall survival was negative. I would say it's not surprising because it's very difficult to identify an overall survival advantage in ovarian cancer patients because the long post-progression survival allows patients to receive several lines of chemo, and the several lines of chemo make a trial very difficult to have data on overall survival. This is why all the authorities, but also the international scientific community, suggest that the PFS should be the primary endpoint in ovarian cancer trial. ANTHALYA trial is the first trial assessing the role of bevacizumab in the neoadjuvant treatment of ovarian cancer. It was a very small trial, no more than 70 patients randomized to receive BEV or not during the neoadjuvant treatment, and the primary endpoint of the trial was the percentage of complete cytoreduction, basing on the assumption that bevacizumab and chemo work together in a synergistic way, and bevacizumab increased by 25% response to chemo. Unfortunately, the trial was negative. The primary endpoint was not reached, but there is the evidence that bevacizumab combined with chemo in the neoadjuvant setting does not increase toxicity. So the percentage of complete cytoreduction was not increased, unfortunately, but the percentage of partial cytoreduction was significantly higher. So in the cases in which the physician considered bevacizumab in a neoadjuvant setting, now we have evidence that this does not increase toxicity for the patient.